A new study found that a pulse oximeter, a device used to measure oxygen saturation in the blood when someone has COVID-19, is actually less accurate in Black and brown patients than in white patients. The critical tool is used to detect severe COVID-19 because low oxygen levels can be a sign of serious illness. And caveat, this is true for other diseases as well. It's a very important device. So it is extremely concerning that Black and Latino patients were 20 to 30% less likely than white patients to be recognized as eligible for severe COVID treatments. A co-author of the study said even a small inaccuracy in estimated oxygen saturation can have significant implications for a patient's treatment options. Joining me now to discuss, Dr. Ebony Hilton. She's a MSNBC medical contributor and an anesthesiologist at the University of Virginia. So why are pulse oximeters, I don't know how to say it. I'm sorry. I've said it differently all afternoon.
Pulse oximeter.
And I wrote it out.
You got it.
It was right? Okay, so break down for us, for folks who either didn't buy one on Amazon at the beginning of the pandemic or have never heard of this device. How important is it? What does it do? And how important is it?
Right. So everyone has encountered this device if you've gone into any doctor's office or into the hospital. You know that little device they put on your finger that makes your finger light up like ET, that little red light? Well, that's a pulse oximeter. And what it does is that it shines light through your finger, and based on the wavelength of light that is absorbed by your blood cells, we should get a response to say this is an approximate area of where your oxygen level is. And the problem is that darker skinned persons, Black and brown patients, what we're seeing is that it's 3 times the frequency of that being erroneous than with white patients. But this is nothing new. We've known this. We've known there's been these false readings since the 1990s when I was in junior high school. So the question I have for the medical community is that we've known this. We have put study after study looking at this. We know that we direct protocols based on what this pulse oximeter actually reads. So how are we going to fix it, right? So we can stop having these same, disparities reported for generations to come.
This is really, really concerning because at the beginning of the pandemic, and even just in my own experience, knowing the importance of a pulse oximeter, just in terms of should you call the ambulance, in any context, I think that it not being able to rely upon that information is terrifying. I mean, how could the technology be less accurate on Black and brown skin? Why is this happening?
Right. And it truly is the way the wavelength of light is absorbed by the skin, by our melanin. Right. Now, what we use that for, that device, it's great because it is a simple device that I can clip onto your finger. Now, as an anesthesiologist, when I'm covering the ICU, what we do is check and make sure that this device is reading accurately based on your blood sample. We take a measurement from your arterial system that says this is exactly how much oxygen is actually dissolved within the blood. Now, that's fantastic to get that reading, but that is a painful process, as you can imagine, if we have to continuously stick someone to see what their blood sample actually means. And it's a costly one. Your ABG, your arterial blood gas, can run you $600 each time. So we need devices that are simple, that can clip onto the finger to give us a reading that we can work with. And there are devices, pulse oximeters, that have a better track record of having a decrease in the discrepancy between Black and white patients. So what we have to do as medical, profession and system is to say, we will only make use of those that have actually corrected for this difference in race and in melanin content within a person, because our patients deserve it. And it does, again, it impacts outcome because it impacts what we actually do for you to help with your oxygen concentration.
This is really troubling. I always want to know who was in the room when people are, coming up with these kinds of ideas. And if anybody raised their hand and was like, hey, if we make the science work on light, that isn't going to work for Black people. But nobody was there in the meeting to be able to say that, apparently. I want to turn to the topic of COVID because it's related, right? I mean, COVID has disproportionately impacted Black and Latino communities. According to the CDC, Black and Latino patients are almost twice as likely to die of COVID-19 versus white patients. So with that in mind, how significant is it that one of the essential tools in fighting COVID-19 and severe disease looks like it doesn't work correctly?
It's incredibly essential. You know, with Black and brown patients, we know that systemically there are issues that impact our outcomes along the lines of COVID. It's not only the medical devices and the inaccuracy that pulse ox can hold, but it's also implicit and explicit bias of providers and whether or not we're admitting patients. It's also the impact of systemic racism on the social determinants of health and what your community looks like, because we know your zip code can be a more important determinant of health than your genetic code. I mean, it literally comes down to the way we write policies, like the vaccine prioritization, of where we had a racial health disparity, and yet we wrote a neutral policy on who was prioritized with the vaccines, which made it essentially pro-white. All right, so these are all the many hurdles that Black and brown patients have to overcome to simply seek help when they are sick. And it's one of those things that we have to take a multi-pronged approach to address each and every hole in this Swiss cheese that leads to us dying at higher rates and younger ages. Because for Black patients, you're 67% higher mortality rate when we adjust for age. It's not that we're old. It's not that we're sick. It's just simply because of all the things we have to overcome, we're more likely to have worse outcomes, and it needs to be fixed.
It really does. This is such a troubling story, and I hope the people who can fix these things are listening. Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.